everybody is watched by doctor finally as a
Okay,
responsible
okay.
person, but AI is assisting. We will scan inside full body, and then
Yeah,
inside the body, this is heart, this is kidney,
yeah,
this is your
yeah.
liver, this is
Mhm,
pancreatic. Everything you
mhm.
will see by yourself.
You have states like Kerala, which is actually quite advanced when it comes to screening, and there is easy availability of screening facilities across that state. But then in other parts of India, it is not so.
So we
Yeah.
implemented high-end technology, medical equipment, and AI together to support this 100 people. And then
Mhm.
doctor will assisted by AI technology to
Yeah.
efficient medical service.
Hello and welcome to another episode of Our Own Devices. In fact, this is going to be the last episode of this season, which has been a really long season with over 25 episodes. And we thought we'll make this special by getting a special guest who is going to again talk about how technology can change human lives for the better. We have with us Mr. Masaharu Morita, who is the founder and program director at Nura, which is a part of Fuji Film. And he's joining us from Japan. Morita-san, thanks for joining.
Thank you very much for inviting us. Yes.
So I'll start by asking you if you could explain what Nora does. And I guess a lot of people don't really recognize brands like Fujifilm with the healthcare industry also, where you are very powerful. You do a lot of things. So if you could explain the connect to our listeners.
Sure. So Fujifilm is basically originally, photography company.
Yeah,
It's
yeah,
established around 90 years ago, and Fujifilm also become a big medical equipment company for CT, MRI, X-ray, endoscopy, ultrasound. This kind of medical device we are
yeah,
making and selling in the world. But we don't stop by this way only, and we decided to make a health screening center by ourselves. We
okay,
utilize our advanced technology and AI technology because um, in Japan is a health screening center, health checkup center is widely available, and everybody have to go health screening annual check. But
yeah,
unfortunately, many developing countries such as India, Middle East, and Africa, they don't have this kind of health screening center much.
yeah.
So our government alone cannot do that. So that's why we
Mm.
decided to support the government by ourselves to establish this kind of new health screening center to make more fair availability to everyone. So this is start of Nura actually.
So how has your work in India panned out so far? I hear you have a partner in India, who works with you. And how long have you been working with them, and what all have you done?
Yeah. So, Fujifilm is a technology company, so it's not a hospital or health screening
Yeah,
service,
yeah,
screening health company. So that's why we made a tie-up with Dr. Kuti Healthcare. They
yeah,
are based in Kerala,
yeah.
and we made a joint venture to open up Neuro. And
Mhm.
we start this collaboration from 2019. And after the COVID, immediately we opened a first center in Bangalore, and
Okay.
after that, we opened Delhi, Mumbai, and Hyderabad, and their hometown, Kerala, Calicut. And also
Yeah.
now we are opening in Dubai and South Africa, Philippines, Malaysia, Thai, everywhere in the world.
Okay. Yeah, that's good to hear. Also because I'm also from Calicut.
Oh,
So
really?
so
Ah,
yeah, so the
very nice country, eh? Nice
yeah.
area, yeah.
So the I want to ask about how this screening, and you explained how Japan has a history, has a culture of medical screening. In a country like India, that is not there. But again, India is not a single unit in that sense, right? Like, you have you have states like Kerala, which is actually quite advanced when it comes to screening, and there is easy availability of screening facilities across that state. But then in other parts of India, it is not so. So how do you tackle this problem? Like, do you go to parts which need the help first, or do you roll it out in a different way?
Basically, Japan is this health screening center existing around already 60, 70. 80 years already.
Yeah.
So it's enough facility, enough medical equipment, enough doctors is there. But
Yeah.
unfortunately, for example, India is still it's lacking of resource even for the
Hmm.
hospital care treatment. So it's a bit difficult to assign this kind of medical resources to the healthy people, for example,
Yeah.
or
Yeah.
preventive culture. It's a bit difficult.
Yeah.
So how we can tackle it is basically utilizing like technology and AIs
Hmm.
to support this lacking of resources. So this is a basic
Yeah.
concept. So for example, if in front of you 100 people, sick people
Yeah.
is how many? Sick people is one or two.
Two.
But
Yeah. Yeah.
health screen, so hospital should take focus in one or two. But health
Hmm.
screening or health checkup is 400.
Yeah.
Everybody have to come. So
Yeah.
that's why it's a big resources required. So we
Yeah.
implemented high-end technology, medical equipment, and AI together to support this 100 people. And then
Hmm.
doctor will assisted by AI technology to
Yeah.
efficient medical service. So this is a way Fujifilm implemented this in this area.
So we have been discussing in this podcast before also how AI, especially in a country like India, can help help plug the gap. So if I understand correctly, in your case, let's say 100 people are screened, the doctors maybe get to see only the 10 which have some possibility of having a problem. The other 90 which are very clearly don't have any issues, don't waste the time of the health resources. Is that a right identification of the problem?
Half right, half not. Basically, AI is anyway AI. It's a AI
Yeah,
cannot take responsibility.
yeah, yeah,
Responsibility is who can take responsibility is a human, is a doctor.
yeah, yeah.
So how doctor can work efficiently? This is the
Mhm.
idea.
Yeah,
So if I will check, if I'm doctor, I will check in, like from your body from top to bottom. It
yeah,
takes 10 minutes, let's say.
yeah.
But how I can check your body by 1 minute? This is
Yeah.
idea.
Mhm.
So it's like if I utilize new technology, advanced
Yeah.
technology, I can be much faster. So
Okay.
this is a way we are implementing. So basically, of course, AI will a lot. I can focus
Yeah.
more in a dedicatedly. If
Yeah.
AI not a lot, then I can see overview. So by this
Yeah.
way, is the doctor is handling. So everybody is watched by doctor finally as a
Okay.
responsible
Okay.
person, but AI is assisting.
So there is always a human in the loop.
Exactly. Yeah.
Right. Right. That's good. That's good. So also you mentioned how Japan has a history of this, which is going back 7, 8 decades. Uh, in a country like India, we don't have that kind of a cultural nuance of having annual health checkup. Even if we can afford it, people avoid that kind of a annual health checkup. So how much of your work is ensuring that there is a cultural push towards a preventive um, annual health checkup kind of a thing? And how do you work on it? Is there an awareness program that you know? Uh, I'm not pinning it down just on Nura, but across the country that an awareness program that needs to be done, that we are ahead uh, of the preventive health checkup curve.
Yeah. So basically, we made it health screening is fun.
Yeah.
Health
Okay.
screening is interesting,
Yeah.
enjoyable. So
Yeah.
this way we implement it.
Yeah.
Because, for example, in Japan, everybody have to go health screening. It's kind of military. We cannot
Yeah.
escape. It's a company
Okay.
is
Yeah.
insisting me to go. So if
Okay.
I escape, then company will punish me. So that's why I
Okay.
have to be go. But
Okay.
India and other country is not like that. It's a more
Yeah.
freedom.
Yeah.
So freedom even force, you can escape. But
Okay.
how we can attract you is, oh,
Yeah.
wow, it's very nice. I want
Yeah.
to come.
Okay.
I want,
Yeah.
and then if you have a good experience, then you will tell
Mhm.
to your wife, hey, I want to protect you as well. Come together with me. And
Okay.
your wife will come. Your wife and you will talk. Only us is take care by ourselves. It's
Yeah.
unfair. I
Yeah.
want to bring
Yeah.
my wife, my
Yeah.
parents.
Yeah.
And then, okay, you will say, okay, I want to bring my parents as well.
Okay.
And you will bring your parents. And the
Yeah.
parents will be happy. Oh, wow,
Yeah.
it's very nice. and then your parents will talk to your neighbors, and then this
Yes.
was
Yeah.
very good, and
Yeah.
everybody will come. So basically, we made it like, it's a health screening is not like in a hospital or where people don't want to go. No, health
Yeah. Yeah.
screening is fun and interesting. This is where we want to go. So
Yeah.
by this way, we change. So that's why it's a many people is coming, and of
Yeah.
course, it many influencer is coming as well. So
Okay.
that's why
Okay.
from digital marketing also it's a spread it word of mouth. So this is a
Okay.
success
Okay.
story. Yeah.
Yeah. Yeah. That's very interesting. And you mentioned how AI is helping doctors speed up the process of um, um, analyzing patients. So, are there diseases uh, or techniques where the AI is really good, and where do you think it still needs to improve?
So this AI is not supporting only doctor, but
Yeah.
also for our guest like you. For
Okay.
example, uh, we will scan inside full body, and then
Yeah.
inside the body, this is heart, this is kidney,
Yeah.
this is your
Yeah.
liver, this is
Mhm,
pancreatic. Everything you
mhm.
will see by yourself. Oh, my
Okay.
heart is very nice, good size, good function, but
Mhm.
my heart has small blockage. Oh,
Yeah.
I have to be
Okay.
careful.
Yeah.
My liver is good enough. Oh, I have only one kidney or two
Okay.
kidney. You never know. But
Yeah.
we will realize for your body inside by AI visualizing. So that's why everybody can understand well. So, for
Mhm.
example, if you go to health screening, for example, in somewhere, your
Yeah.
cholesterol is 100 or 200, your triglyceride is too much. We don't know what is going on, but we
Mhm.
cannot identify the number by ourselves as
Yeah.
common man, layman.
Yeah.
But we can show all your body as visualized. So it's very
Yeah.
interesting to understandable. So
Yeah.
understandable. So that's why it's fun. That's why
Yeah.
I want to take care. Next year when I will come, I want to reduce little bit my liver, fatty liver,
Yeah.
for example.
Okay.
This
Okay.
kind of it's a visualize. This is
Yeah.
very
Yeah.
important. So this way we utilize AI. Yeah.
So it's in a way like a gamification of life, right? So people are looking at it. So next year they want to improve on that score that they got in the first health checkup, right? So it
Mm.
creates that kind of internal requirement from the users themselves, right?
Exactly,
Yeah.
exactly. So basically, if scan and the white
Mhm.
and black, basically, right? You
Yeah.
see
Okay.
white and black, but you don't
Yeah.
know what you are seeing actually. But
Yes.
we can
Yes.
recognize this is your visceral fat. This is
Okay.
your liver. So
Okay.
your size is like that. Next year,
Okay.
better to be like that. And
Yeah.
next year, if you will come, you can see this is last year. This is this
Okay.
year. Wow, you
Okay.
become
Yeah.
great or not. So
Okay.
it's interesting, yeah.
Okay. So we mentioned how there is a cultural gap in India, but there is also at times an affordability issue. So how are you working on the affordability? How do you ensure that this kind of technology becomes accessible to everybody?
Yes. So affordability is a bit subjective matter, I feel,
Yeah.
but as much as possible, with the affordable price, we are trying to
Mhm.
do that. So if Fujifilm make a machine and AI, and if I will bring by myself, of course,
Yeah.
it can be like more like reasonable cost I can provide.
Mhm. Mhm.
So by this way, we are doing effort. But
Yeah.
this price level, for example, $1 every day,
Yeah.
$1, or
Yeah.
like 0.5, which
Yeah.
mean around how much is that? 80 dirham or 40 dirham? Sorry,
Yeah.
sorry,
40 rupees.
40
Yeah.
rupee,
40
40
rupees
rupee,
in
yes.
India. Yeah. Yeah. Yeah.
Yeah, 40 rupee per day.
Yeah. Is
It's I think
affordable.
it's
Yeah.
reasonable,
Yeah. Yeah.
affordable
It's
for
affordable to
everyone.
everybody. Yeah.
Yeah, so if you want to go, you can come. But
Mhm.
if you don't want to go, anyway,
Yeah.
it's not affordable. So
Not true.
we made it every day 40 rupee. So I thought
Yeah.
it's affordable. Yeah.
Yeah. So in India, like you go to any hospital, you go to private hospitals, government hospitals, there is always a rush of people. Do you think this kind of a preventive healthcare system like you have in Japan, once it becomes widespread, also reduces the load on the hospitals, on clinics, so that ultimately only people who who really need to go to the hospital is actually taking up the time of a doctor.
I think so. I think
Yeah.
so. It's a yeah, it's a good point. Yes. So basically, we can identify the any issue by health screening, and then
Mhm.
only necessary people will go to hospital. Then maybe
Yeah.
hospital workload also will be lesser. I hope so. And
Yeah.
also, it's an important point is, for example, if you get a cancer, if you
Mhm.
identify after you feel, oh, something wrong, this is already
Yeah.
symptomatic. Then if
Yeah.
you go hospital, then like you have to be very deep treatment inside of the
Yeah.
hospital, and you
Yeah.
have to stay like in hospitalized 2 weeks, 1 month, something like
Yeah.
that.
Yeah.
But
Yeah.
if we can find at a very early stage of the cancer in your body, for example,
Yeah.
even
Yeah.
you don't feel anything, but if we
Yeah.
can find, then immediately we will remove it only this point.
Yeah.
Then
Yeah.
you have no feeling and you treat it
Yeah.
basically.
Yeah.
So
True.
this like some problem come from small and
Yeah.
become bigger.
Yeah.
Once bigger, it's difficult to treat,
Yeah.
but once
Yeah.
small, it's
Yeah.
easy to treat. So that's why in the hospital, like workload also will be lesser if we can
Yeah.
find at the early stage, and definitely survival rate will be much higher. For example,
Yeah.
in Japan, is a cancer is no more like death disease basically because if
Mhm.
we can
Mm.
find at the very early stage of the cancer, it we
Yeah.
feel no death disease. It's
Yeah.
treatable. But
Yeah.
unfortunately, for example, India is a
Yeah.
cancer is death disease. Everybody's thinking
Yes.
because
Yes.
no health screening. So that's
Yeah.
why find that
It's
later
usually
stage.
in the late stage. Yeah.
Later stage mean the cancer disease is spread everywhere, so cannot treat
Yeah.
anymore, and the hospital
Yeah.
also very difficult.
Yeah.
So find at early stage, same as car. If
Yeah.
something wrong in the brake
Yeah.
pad is little bit problem, brake pad
Yeah.
change, then no
Yes.
problem.
No problem.
But
Yeah.
if don't you don't change, you will
Yeah.
hit in somewhere.
Yeah.
So it's the
True.
same things. Mm.
Yeah. Yeah. So how much, do you think at some point, especially in a country like India, the government needs to get involved in preventive healthcare?
From my experience, it's not easy actually.
Mhm. Mm.
Because when I was in Dubai as
Yeah.
a general manager of Fuji Film medical business for Middle East and Africa,
Yeah.
I talked with many government officers,
Yeah.
but they are a bit busy to establish more hospitals.
Mm.
So it's very difficult to focus preventive health at that
Yeah.
time, especially.
Yeah.
So if has a more resource, they want to make more hospital and more specialized hospital. This is also
Yeah.
important actually to treat
Yeah.
people.
Yeah.
So then I thought, why not us as private to support
Mm.
this society? Not only
Right.
Fuji or not only us, but also
Yeah.
once we start, everybody will start. Then
Yeah.
everybody take care of this society by ourselves together in a
Yeah.
private. So this is my imagination, but
Mhm.
of course, like some country is maybe possibility if
Yeah.
small number of population or big amount of money. In this case, maybe they can do easily, but like
Yeah.
India, it's so
Very
much
tough. Yeah.
population and it's not easy.
Yeah.
Mm.
Totally. True. So, if I can ask you one last question,
Mm.
with your venture, how would you quantify success, right? Like, uh, is there a public health outcome that you would aspire to achieve, at least in the areas where you are, effective and working?
Mm. It's a um our work is very small.
Yeah. Yeah.
By ourselves only, it's one center we can accommodate only 10,000 people.
Yeah.
So it's very difficult to cover everyone.
Yeah. No,
So
but if
at
you're talking about the people who are coming to you, how would you
that,
quantify success
yes.
for them? Yeah.
For example, it's a we are saving a lot of lives already.
Hmm. Yeah.
We did the screening from 2020. We already reached around 12, 120,000, we did
Yeah.
already screening. So many, include my friend, was secured life.
Hmm.
For
Hmm.
example, like my very important person could find a very early stage of heart attack, for
Okay.
example. It's a big
Okay.
blockage was there. So
Okay.
before heart attack happened, he could go hospital and he
Hmm.
put open this vessel. So that's
Yeah.
why he
Yeah.
could avoid the heart attack itself. So
Yeah.
it was
Yeah.
very significant my achievement by myself. And
Yeah.
also his relative, we could find the cancer, and then like he also treated well. For example,
Hmm.
lung cancer or pancreatic cancer, it's a
Yeah.
death ratio is very high.
Yeah.
Even in Japan, it's very high because
Yeah.
this is
Yeah.
very aggressive cancer. But
Yes. Yes.
they are saved
Yeah.
with our
Because of.
screening.
Yeah. Yeah.
So I'm seeing in front of me, it many people is saved the life, and then I
Yeah.
could make them good longevity life. So
Yeah.
this is itself is for me it's very satisfied. But
Yes.
yeah,
So, on that positive note, so thank you for being on the show. And I'm sure there is a lot that technology can do in actually improving lives. And this is a great example. And I'm just hoping we are able to scale this up and cover as many people across the world as possible.
sure. Thank you.
So, you were listening to the last episode of Our Own Devices for this season. We'll be back again in a few months with the latest season, where we will again talk about a lot more knowledge, insights, and technology at large. Till then, goodbye.